Good morning, everyone. It is so nice to see people back in person at the LAN Summit after 4 years. For all of those who have come in a little, not quite so early, there is a bunch of seating up here at front. Come on down, come on. Don't be afraid to go first. Plenty of seating, come on. I'll keep talking. I can talk through anything, but I do want you're going to be able to appreciate more if you don't have to worry about standing in a crowd. I also want to thank all of those of you who are joining us virtually here today. Now that we're in this new hybrid era, and I really want to thank John Blum for those important insights and that challenge to, despite all of the issues we're facing today, the challenges and the opportunities to get to a transformed healthcare system and the partnership with states and the private sector that's so critical to that, and that's what the LAN is all about. And thanks to Alice for her contributions to making that happen and for her kickoff comments this morning. So as you heard from Alice, the LAN is the Learning and Action Network, and is increasingly about action. Action to advance accountable care that centers on each person, meaning it's coordinated, longitudinal, affordable, and reflects what matters to each person. And this is a public-private goal, as John said, to create a healthcare system that achieves the best outcomes for everyone at the lowest cost by building on these approaches. Obviously a challenging goal, but today we're going to hear about some new efforts and insights about how to address these challenges together. We've already heard about some of the new steps and plans at CMS. We're going to hear more from LAN state and private sector partners today. To set that up, I want to provide a few minutes of comments or an overview about some of the key activities at the LAN now and planned for the year ahead. So first off, just a reminder about the goals of the LAN. 3 main goals for advancing accountable care, and you can see the LAN's definition of accountable care here. We are about advancing payment reform, but it's important to recognize that that's the means to the end of achieving care that centers on the patient. Effective mechanisms for paying for better health at the person level, not just paying for traditional medical services, supports the needed innovations in care that are difficult or impossible to achieve under traditional fee-for-service payment. But along with accelerating adoption of effective accountable care arrangements, the LAN is focused on 2 related goals: developing models that improve health equity by enabling healthcare organizations to better address the causes of disparities in access to needed health care and health outcomes, and promoting multi-stakeholder alignment through sharing approaches to measurement, data interoperability, and other key aspects of accountable care models where aligned approaches can reduce administrative burdens and increase the impact of similar reforms across different payers and purchasers. As many of you know, and you've heard about earlier, since before the pandemic, the LAN and CMS have set some shared ambitious goals for the coming years. By 2030, for 100% of Medicare beneficiaries, the vast majority of Medicaid beneficiaries have access to accountable care relationships that support whole person coordinated care, and for most commercial, privately insured individuals to have that kind of access too. The LAN is a public-private collaboration for effective action to accelerate the availability of accountable care, and our diverse multi-payer healthcare system really needs that kind of support to get there. One key activity of the LAN is to advance these goals through seeing where we are, national benchmarks of where healthcare payment is and where healthcare stakeholders think it's going. This afternoon, we'll have a full presentation and discussion of the LAN's latest annual survey of healthcare payers, completed this year to assess progress in 2022. As you'll hear, we saw progress in payment shifts away from fee-for-service across all major types of coverage: traditional Medicare and Medicare Advantage, Medicaid, and commercial insurance. In particular, the use of alternative payment models that have a significant shift away from fee-for-service, the so-called downside risk models, including primary care payments with accountability for total cost of care, bundled payments for specialty care, and whole person or direct contracting payments, increased by 5 percentage points, the fastest growth rate that we've seen, and a significant acceleration from the 2 percentage point growth rate in 2021. So not only did APM adoption accelerate coming out of the pandemic, but the vast majority of payers are expecting further growth this year and beyond. And in addition, for the first time, the LAN survey now includes data on all covered lives and accountable relationships. And this is a survey expansion to capture the broader set of supports for longitudinal coordinated care reforms that are at the heart of the LAN's mission. The acceleration in accountable payment reforms is important progress towards the LAN goals, but we recognize that further action is needed in that challenging healthcare environment that John Blum just referenced, with continuing economic pressures, workforce issues, the loss of additional payments and flexibilities from the pandemic, rising distrust, and many other challenges. As John said, healthcare organizations are stretched, so positive change is challenging. But rather than simply trying to get by in the face of these challenges, what our survey and other major LAN activities has found is that more healthcare organizations are adopting accountable care to help address these core challenges. We're facing significant healthcare cost pressures, especially in employer coverage, where alternative payment model adoption has lagged, but is now starting to accelerate. The LAN is also working hard to expand, as John said, the CMMI and private sector programs that have evidence-based proof of reducing costs, like accountability for total costs of care, along with enhanced payments for advanced primary care in Medicare's longitudinal shared savings program, and further promising results coming from ongoing pilots, like those that provide advanced payments to smaller primary care and safety net providers. And as CMS just reported, the early years of the advanced direct contracting programs are also saving money. Healthcare workforce shortages and burnout remain top of mind for healthcare leaders and policymakers. Burnout among our health professionals has also never been higher, but as a new survey just showed this week, effective accountable care reforms reduce burnout because providers are better supported as teams in focusing on what they think is most important to patients' well-being, not short-term fee-for-service-based visits and procedures. Value-based care reforms are also about reaching people where they are and strengthening trust through ongoing relationships. Healthcare organizations further along the transformation curve fared better in the pandemic, and they have better data, workforce capabilities, and relationships to address population health challenges in their communities. So reflecting all these opportunities and the urgency of accelerating progress, the LAN is taking steps to make this year the most ambitious and action-oriented yet. With these challenges and opportunities in mind, I want to briefly turn to an overview of the LAN's other current and planned activities. So these include shared learning to spread best practices and accelerate confident action about implementing accountable reforms, new and more sustained efforts for alignment across payers, where alignment can reduce the burden and increase the impact of individual payer reforms. This multi-payer work will feature expanded efforts to identify and support effective approaches for engaging specialty care in whole person coordinated care models. And of course, the LAN continues to build on its efforts to improve equity through an intentional focus on accountability for care improvements for everyone in our communities. Turning to the LAN's expanded shared learning activities, the LAN created the Accountable Care Action Collaborative a year ago. You heard from Alice how that group is expanding now with a shared commitment to accelerate accountable care reforms. The ACAC has launched the Accountable Care Curve, which is a resource that brings together the diverse experiences and expertise of all of these groups and their members around what works in accountable care reform. And we know that that's different across urban and rural areas, small and large organizations, who are on different positions on the journey towards adopting the steps needed to transform care. The Accountable Care Curve is a dynamic resource that facilitates adoption of alternative payment models as well as critical supporting reforms by helping organizations and people engaging in these efforts find where they are and see similar experiences that organizations like theirs have gone through, including around improving quality measurement and quality improvement activities, supporting data infrastructure, interoperability to advance health equity, multi-stakeholder alignment on data and measurement standards, and other supporting components of accountable care reforms. We're going to keep updating and deepening these tools based on the accumulating knowledge, confidence, and success in accountable care reforms. The Accountable Care Action Collaborative adds to the LAN's ongoing alignment efforts, which include efforts to promote directional and technical alignment across public and private payers to reduce administrative burden and increase the impact of individual accountable care reforms. We've launched the State Transformation Collaboratives in 4 diverse states to promote action and shareable insights, tools, and guidance, not only in those states, but on effective multi-stakeholder collaboration that can be adopted more widely to advance accountable care across the country. The State Transformation Collaboratives released a multi-payer blueprint, which builds on work by Duke-Margolis and others to show how states can succeed in aligning payment transformation efforts across payer markets in areas like performance measurement and reporting, health equity, payment model components, and data sharing. The LAN is now reinforcing these efforts through a new national health plan work group that will help identify alignment opportunities across these national and regional efforts, again with the goal of reducing administrative burden and making it easier to improve care delivery through directional alignment steps across all of these diverse reform efforts underway at CMS, in national plans, and across many states. While CMS has this broad goal and a broad range of stakeholders coming together for engagement in many of their own initiatives, many of the CMS initiatives, these public-private collaborations supported by the LAN provide additional opportunities to inform CMS initiatives to increase alignment and reduce burden for healthcare reforms, like CMS's efforts around quality measurement, its universal foundation for quality measures, like its efforts around expanding electronic record standards to share and use health data to support longitudinal coordinated care, and also to help assure that CMMI payment reforms are synergizing with accountable care reforms in Medicaid and commercial insurance. So a key part of multi-payer alignment involves better approaches to integrating specialty care into accountable care payment arrangements and delivery models. Many specialists and specialty care models aren't yet well integrated into accountable care, which creates barriers to the goal of whole person longitudinal coordinated care. This LAN multi-payer alignment effort in the coming year is going to focus on identifying tools and practices to encourage and advance specialist participation. For example, feasible performance measures that are being used and could be adopted more widely to identify and support high-value specialty care. Learning from the increased adoption of payment reforms for specialty out care that are taking place outside of traditional Medicare, such as care coordination and e-consult payments, per-person payments for accountable specialty care providers, including centers of excellence for some specialty conditions, and also subcapitation arrangements for some specialty care providers. Looking ahead, as Medicare and other payers turn more attention to integrating specialty care effectively, the LAN aims to scale the best practices and facilitate alignment in these efforts, and we brought on some new members and perspectives to help us do that. Later today, we'll have a session on another critical area of LAN activity, doing more to address diverse population health needs and advance health equity. Accountable care can enable healthcare to do much more to address the diverse and distinct needs of different populations, as John Blum emphasized as well, but doing so requires an intentional focus, for example, on advancing reliable measures of quality of care and outcomes across different racial, ethnic, and language groups, and helping to address the social determinants that have been a major impact, a major influence on quality of care and health outcomes for these populations. Much of this is supported through the LAN's Public-Private Health Equity Action Team, HEAT, and the LAN is also standing up a new Person Perspective Council to further advance these efforts. One of the recent products from this overall approach was a new guidance document on recommendations for healthcare entities partnering with community-based organizations. So please take a look at that. It will be discussed this afternoon. It has recommendations and real-world examples on how to integrate addressing health-related social needs in accountable care reform efforts. So that is an overview of some of the major LAN ongoing activities and plans to build on them. I have an appendix slide along with this deck which will be available. Also encourage you to take a look at that LAN annual report if you're interested in getting engaged more. And I want to thank all of the leaders and all of you who are with us today and contributing to these new and updated initiatives of the LAN. We're looking forward to working together to take further steps to achieve the goals of equitable, affordable, coordinated care for all Americans. And boy, those goals are more urgent than ever, and it's great to see this level of engagement. Thank you all very much for being here and being part of this journey. Thank you so much. And now, I think we're going to have a short break and continue into those sessions that Alice introduced already today. Thanks again. I'm looking forward to opportunities to interact with all of you today.